Over the course of the next year, we are going into extensive coverage of the opioid crisis that plagues Oklahoma. You know, we consistently rank among the top 10 states for painkiller deaths, and we're starting with its youngest and smallest victims, babies, who were born addicted to addicted mothers. So here with us to discuss the problem, we have neonatologist Dr. Edward Coe from Integris Baptist. Thank you so much for being with us here today. We appreciate your time.
Thank you very much.
It's hard to even wrap your head around this, how a baby is born addicted to painkillers, born in drug withdrawal. Explain how this happens to those children.
Yeah, so what happened is babies are born because the mom had been on the opioids, and for pain, chronic pain. And what happened is once they're born, that medication, that opioid is removed from the system, from the baby, being transferred to the baby. So then the baby then develop a withdrawal symptoms. Withdrawal symptoms means that, the baby starts having problems with the central nervous system, autonomic nervous system, peripheral nervous system. And what they present are symptoms like there are withdrawal, which is, they have weight loss, they have irritability, they have tremors, they have high-pitched cry, reflux, they have a lot of dysfunction with suck and swallowing, they have problems with restlessness, and they have problems with agitation, and they have other problems like wakefulness, and a lot of anxiety, and a lot of what do you call this one? A lot of working, incessantly and moving left and right, and really cannot control themselves.
Just a slew of unfortunate side effects there. And you treat them as though you would, treat the moms who are addicted. I mean, once that umbilical cord is cut, they no longer have that supply of drugs anymore. So you slowly have to wean them off? Yes.
Unfortunately, the drug to treat them are the same drug that you basically the mother have received. So like mom who are, especially now, the prescription drugs, they have been on, and the medicine that they use to treat them for therapy is the same drugs like methadone, buprenorphines. These drugs, even though they are supposed to be better for them during pregnancy rather than the other medications. What happened is this baby needs some of those medications. So on those babies, we basically give them, like, the two most common drugs that we use are morphine and methadone. And because they withdraw, because the main mechanism is that they have, all these are affecting the central nervous system and the autonomic nervous system. So there are neurotransmitters in the brain. Basically, what they have, like the effect on the dopamine, they call dopaminergic centers, and that is the dopamine effect. And the dopamine effect is when babies are movement, like you have Parkinson's disease, they have deficiency of dopamine. They tend to have all those tremors, those abnormal movements, and then they have the serotonin problem too. When serotonin is more of the mood, anxiety. So now, if you have this problem, you're going to have also anxiety and agitation.
Yeah.
And then.
And do you want to talk about, it's not just sad, it's a reality that you're seeing, on a pretty common basis. You're saying that you're seeing more of this. Talk to us in terms of numbers of what kind of issue this is for infants here in Oklahoma.
Yes, like for our hospital, we look back at the last 2 years, let's say. We have close to about 25, 30 2 years ago. We now have, last year, we have close to about 35 to 40 babies.
40 babies in 1 year.
In the NICU.
Addicted.
And in the NICU. Now, there are babies that don't come to the NICU because they didn't have as much as symptoms, but once they present the withdrawal symptoms, they get admitted to our NICU. And the symptoms can vary. It can come immediately within the first 3 days. Some comes within like the next 3 to 1 week. And on average, the American Academy of Pediatrics recommend that most babies who have moms that have used these chronic, opioids, babies needs to be observed for at least 5 days on average.
And we talked to a doctor with OU Physicians. He said 4% of painkiller prescriptions nationwide are used for non-medical reasons. Here in Oklahoma, that number is doubled. You said you've seen a spike in babies being addicted to painkillers. Why are we seeing that spike?
I think
What's happening here?
Yes, I think basically what happened is that in the past we used to have the cocaine problems. Then we end up with problems with methamphetamines, and now because those were illicit drug use. Now it's easier now with prescription because because we were all into this mindset that we need to control pain, and so so physicians are prescribing that, patients are asking for it, and so once you get it's just like it may looks like it's candy or something that it's easy to get, but once you get into the habit of that, it's hard to get out of it because you get addicted to that, and that's the problem, and it was easy to use, but now the DEA is getting tough on physicians and making sure that they don't they don't prescribe unnecessarily, and I think education to parents and mothers we're getting there. I think the lack of education was a problem because they think that everything is there's no side, it's going to be fine, baby's going to be fine, but if you see those babies in our NICU, they stay in the hospital for at least 3 to 6 weeks, some even longer, and the cost to healthcare, and not only that, the problem is the baby.
Right.
And that's sad.
And my last quick question to you, because we are running out of time here, if there's a mother listening right now, a family who's going through this problem, they're addicted and they need help, where should they turn to right now?
I think they would need to turn first to the doctors. Make sure the doctors tell them that those medications are not good for them, and they also have a counseling group that they can go for, education. And even with us, when they come to our NICU, we do talk to those parents. And the sad part is a lot of things we can do with these parents is really educate them, cooperate with them, be emphatic about and show empathy to them, and be more collaborative between physicians and parents. That's the most important thing.
Okay, Dr. Edward Ko, thank you so much for your time.
Thank you
do
very
appreciate
much.
it. It's a big
Yes,
problem.
welcome.